Hello, everyone. I'm Nguyen Heather Do from College of Nursing and Health Professions. For this year's Star Scholars program, I've been participating in a project called a clinimetric analysis of wound measurement with my mentor, Dr. Di Maria Galilei. This project is part of the larger study on the effect of low intensity, low frequency ultrasound on chronic wound healing. Our aim in this project is to measure and compare the inter-rater reliability of wound tracing method that we developed to the reliability rate of the ruler method. The ruler method is still the most commonly used method because it only requires a ruler to measure for the width and length of the wound, and then timing them together, and then we got the wound area. However, because of this, this method is also prone to a higher level of overestimation, up to 40% of overestimation. So how do we perform the wound tracing method? We photograph the wound images of 20 patients and trace the wound border in the paint application and process them through MATLAB. The data is then calculated into intra-class correlation coefficient. As the result, 55% of the cases using wound tracing method has an acceptable reliability rate, which is defined as intra-class correlation coefficient higher than 0.7, while this number is only 35% for ruler method, indicating that wound tracing can have a higher inter-rater reliability rate than ruler method. However, the reliability rate of wound tracing method is still not as high as we expected, and this is because of three reasons. First, the first and foremost reason is because of the low quality images that usually happen in the first 10 patients because the photographer might not be used to the procedure yet. However, this problem has already been resolved in the last 10 patients, which is shown as 90% of the cases have an acceptable reliability rate. The second reason is the inconsistency amongst raters. Our raters were trained at different times, so there can be a difference in our understanding of the wound border. For example, a question usually arises is, this is part of the wound, but it's not necessarily the part of the wound bed, so should we still include it in the tracing procedure? The third reason is that the discharge of exudate and blood can lead to unclear border, and also it makes the images flashy. So this can be hard for the tracing procedure. In general, wound tracing is a reliable and useful method for wound measurement, especially for clinical research. But further studies still needed to measure for the accuracy of this method, as our project only measure the reliability of it. Lastly, I would like to say thank you to my mentor, Dr. Di Maria Galilei, my project manager, Mr. Zach Hathaway, and my peer assistant, Pratna Patel, for helping me with everything they can to make this project successful. Thank you everyone for listening.